G'day Attune practitioners and staff. Today I wanted to talk a little bit about the products that we have and how we go about getting those into our clients' hands and why we have them. So look, as practitioners particularly, sometimes we just want to be able to suggest certain products to our clients, and then we're able to do this as practitioners, particularly practitioner only products. So we don't always have to go to the naturopath to get some of these more natural products. So we have a range that Amanda is going to tell you about in a second. She's going to go into the science, she's going to go into the contraindications, and we've also got some information and fact sheets for you to go with this. So if you want to have a read of stuff and get a little bit more clear in your head, that will be available. All the pricing will also be available to you as well, so you'll know at the actual point of contact of your clients exactly the cost of all of these, which is really important when it comes to presenting a really good system of care to our clients. So with that, one of the big things that I have noticed is that we have a referral pad, which is this one right here. Now, that referral pad often can get lost. You're often looking around your desk, where is it, what's going on, and basically you can't find it. And so then you still want your client to get the product, but we really need to be filling out one of these for many, many reasons. It's really important for professionalism, but also so that the staff at the front know exactly what they've been asked for, what you've ordered, and if they can get a repeat of these things. Because if someone wants to come back and get a repeat of the products that we recommend, they can do that, and it will all be on this. They can just present this, and then it's easy for our reception girls to actually go, yep, I can get you a repeat. Otherwise, it starts to get a little bit tricky because our receptionists haven't got the clinical skill, and so they don't know if they need a review, if they don't, and it's not fair for us to expect them to do so. So we need to use these pads when we refer for our practitioner-only products. But on top of that, we don't know where they are. So we've devised a system that you'll see right here that all desks will get over the next couple of weeks, where you're going to have your appointment information on here. It'll go right in there. All your x-rays and all the referral pads that you require will sit here, and then this referral pad for products will sit right there, and it will sit on a place in the desk where everyone can find it. Now, it's really important. This is only used for those things. I don't want to see other bits of paper, books, anything else go into that space. That is dedicated so that anyone who walks into the room knows that they can get their referral pads, they can get the appointment information and their x-ray referrals or what other referrals they need. They can get it right there. It's going to be right at the tip of their hands, so they don't have to search through their desks and look really unprofessional. So hopefully that makes sense. All the products that you're going to recommend for your clients will be behind the reception desk somewhere in all the different desks. So all you need to do is you can go and grab one. It's often great to grab one and show a client, this is what we're going to get you, and then you give it to the receptionist. Or if you send it out with the slip, the receptionist will have one on hand and they'll be able to just grab one and give it to the client. So it's entirely up to you how you want to manage that part of your referral system or your client management. However, we want you to know that there's a list of products now that you have that you can use as a practitioner to give as an added value to your clients. So Amanda now is going to explain to us all the different products we have and the science behind it. So you are very well educated, and all the science and the reasons why are really important when it comes for you helping people understand why they need these products. Why do I go your product and not one off the shelf? All those type of information is really important to give your clients the best possible help when it comes to their condition. So thanks for listening. Have a great week. See you later.
Hi, this is Amanda from Atune Health Centres. Today I'm going to talk to you about some of the products that we as practitioners have been using, and these are practitioner only products. So these are the ones that are not available just off the shelf from the chemist or supermarket or say your health food store. And there are different reasons why they aren't, and I'm going to go through some of those with you today. So it's important to understand the differences between some of the products and also some of the contraindications, drug, herb, nutrient interactions, to be aware of them before prescribing, and also to understand that these are therapeutic doses that we use, and they have been backed up by clinical trials. So I'll be going through some of the products such as glucosamine, fish oils, as anti-inflammatories, and I'll also be going through magnesium with you today, as well as other anti-inflammatories to help with something like arthritis. Alright, so listen up and I'll go through them in detail. Thank you. Okay, so the first one I'm going to talk about is glucosamine. We've got a couple of products with glucosamine in them, and I'll just go through some of the differences with you now. So the first one we have here is from Metagenics. This is called Arthrex. This not only has glucosamine in it at a high dose, but it's also got gelatin in it at 10 grams, and it's also got MSM, which is known to be a good anti-inflammatory. It's also got silica in there, vitamin K, vitamin D, and boron. So these are all nutrients that help to support the growth and the repair of cartilage and bone. So really a good synergistic formula. Now the reason this might be different from one that you find off the shelf is that, well, first of all, the gelatin, this is one it's a proprietary blend, so it's been purified in a way that it doesn't have the heavy metals in it that the one off the shelf can have, for example. It's got a good therapeutic dose of the gelatin, and also with the glucosamine, it's the sulfate form as opposed to the hydrochloride. The hydrochloride form is also sold, but there have been more clinical studies using the glucosamine sulfate form, and this dose here is 2 grams per scoop, so it's a really good dose of glucosamine sulfate. You need to have at least 1,500 milligrams per day as a therapeutic dose of glucosamine sulfate. And also the MSM, that's also a very high therapeutic dose at 1.5 grams. So the reason it works well is because it has a synergistic effect with the other nutrients. So glucosamine and MSM, for example, alongside gelatin, have been found to be more effective than MSM on its own. Because a lot of people just go to the shops and buy the MSM, and then they come to me and say, oh, it's not really helping, it's not working. Or they might buy glucosamine off the shelf and not know the proper dose of it. So it's really important that they're using a product that's actually going to work for them. Otherwise, they're really just wasting their money. And then, of course, it's got the supporting nutrients, as mentioned before. The vitamin D, which is at 1,000 IU. It's a good maintenance dose of vitamin D. Vitamin K, borax as well, to support bone and cartilage health. So that's Arthrex. Now I'll just go through some of the contraindications, because glucosamine is contraindicated with warfarin because it can increase bleeding time. So you do need to be aware that either taking glucosamine alone or in combination with chondroitin can increase the anticoagulant effect of warfarin. So please be aware of that. Also the vitamin K in there can affect the bleeding time as well, as it increases coagulation. Glucosamine sulfate can also contribute to chemotherapeutic resistance. So anyone on chemotherapy, I'd be very careful using that as well. Another one is that glucosamine can affect insulin resistance. There's a bit of contradictory evidence there. So just also to be aware of a person's status there in terms of diabetes or their blood sugar levels, for example. If they're prone to something like insulin resistance, metabolic syndrome, just also have that in mind. And also with the vitamin D supplementation, that's also cautioned in someone with sarcoidosis or with hyperparathyroidism. So they need to have medical supervision if that is the case. Now I'll just go through this other one here. So this is the powdered form, so they need to take 1 big scoop per day, and that's it. For a therapeutic dose. And then the second one here, these are tablets, so the therapeutic dose is 1 tablet 3 times a day. This is also a practitioner-only product from MediHerb. Now this one combines glucosamine, sulfate, chondroitin, as well as boswellia. Boswellia is a really well-known anti-inflammatory, anti-arthritic herb. It can have some herb drug interactions that you also need to be aware of before prescribing, but it's very effective as an anti-inflammatory. Now this also contains synergistic nutrients such as vitamin C, zinc, boron, as mentioned before, selenium as a natural antioxidant. It's important for the joints, manganese and copper. So this one is good as a tablet, I suppose, if someone doesn't want to take the powdered form, or if the MSM glucosamine gelatin formula is not something that they want to take, for example. And I just thought I'd also mention that there are also vegan formulas available that that you can also prescribe. I don't have it right here now, but this is possible because some people who either have a shellfish allergy, intolerance, or if they're vegan, they don't want to take these products. So just be aware of that that's also something that we have available at Atune. Okay, so that's glucosamine for you. Okay, so now I'm going to talk about magnesium and the reason we have magnesium as a practitioner-only product, because there's so much magnesium everywhere on the shelves to buy. So why get a practitioner one? Okay, so as an I guess an overall general statement, the practitioner products will be they have less excipients in them, and the form of the magnesium in them is also going to be a specific form that doesn't, for example, have a laxative effect. It isn't irritating to the gut, and it's a highly absorbable form. So that's the first thing that you've got to look at when you look at our magnesium. Now, why consider magnesium at all? So many people coming to you, have magnesium deficiencies. It's second only to potassium as the most abundant cation in humans. It's a structural cofactor of over 300 enzyme reactions in the body, and some of those reactions include protein synthesis, fatty acid oxidation, cellular energy, mitochondrial synthesis, DNA and RNA synthesis. So it's a really important mineral for so many different reactions. So it's also important for managing bone metabolism, nerve transmission, cardiac excitability, neuromuscular conditions, muscular contractions, and blood pressure. It's a natural calcium channel blocker. And the problem is that most Australians don't actually consume enough magnesium in their diet. So magnesium is found in things like green leafy vegetables, legumes and nuts. There's not so much in meat and potatoes and dairy. And the problem is that substances like alcohol will deprive you of magnesium, as well as soft drinks because they're high in phosphorus. A diet that's too high in calcium or too much dairy, a more of an acidic diet, and caffeine, they're all substances in the common Western diet that will actually deplete you of magnesium. And you just think about how many people are walking through your door that are under this category. Also, increased sweating, increased stress, diarrhea, vomiting, excessive bleeding in women, diuretics and certain medications can cause a deficiency of magnesium. So I just want you to be aware of that and let a little light glow go off when you hear that from your patients. So it can be effective for so many different conditions. I'll just name a few: ADHD, anxiety, chronic fatigue, restless leg syndrome, leg cramps, premenstrual syndrome, just to name a few. Okay, so let's go through the one that we recommend at Atune. This is called Magtor XL. It is from magnesium diglycinate, which is an amino acid chelate. This is more absorbable. It also has other forms such as magnesium citrate in it, and the dosage is 350 milligrams per scoop or teaspoon. So it's a good high dose. It's specific in terms of the form of magnesium that you're going to get, and it's also excipient free. Companies like the practitioner companies, they will disclose every single excipient that they've got in there, so you can really be confident that there's nothing in there that is going to worsen a patient's condition. Okay, so something like this also has activated B vitamins. So activated B vitamins are also really important. But I should mention that some people can react to folinic acid or the 5-methyl tetrahydrofolate form of folic acid. So this is why it's a practitioner product as well. it's important that a person is not overly deficient in the activated form, that they may need to start on a general B vitamin first before they go on something like an activated folinic acid. But it's far more effective, and a lot of people have a genetic polymorphism that prevents them from being able to activate folic acid, so then it can't be used. And then you get a build-up of homocysteine in the body, which has other problems on top of it. Okay, so something like this also contains zinc citrate, and it contains other activated B vitamins such as vitamin B6, B12, and B2. So these are all important to note, because you're not going to get the activated vitamins off the shelf, and it's because they're more effective and because some people can have reactions to them. So please be aware of that as well. I guess what we need to just be aware of is that magnesium is also really important for neurotransmission. It blocks the NMDA receptor where glutamate acts, so it helps to act as a neuro inhibitor, for example. It will help to upregulate GABA and downregulate glutamate, so just reducing that neuroexcitability. I guess I'll just go through some of the contraindications and precautions with using something like a magnesium supplementation, especially if people are using magnesium long term. That's what you've got to be aware of as well, because if they're needing this all the time, we've got to look at the underlying factors. Do they have malabsorption problems? Do they have a pH imbalance? Because if they do, then this is also going to affect how well they can utilize magnesium, and we need to address those underlying factors. So please be aware of that. If people are on this for years and saying, well, yes, it's still working, but please ask them why they're on it for so long, and ask a few other questions. So if anyone has compromised kidney function, they should be careful of using magnesium supplements. It is contraindicated in kidney failure and heart block. You have to be careful with anyone who has diarrhea as well, that you're not using the oxide form, but also too much magnesium will then also have a laxative effect. So ask those questions. Tetracycline, antibiotic, as well as fluoroquinolones, they form insoluble complexes with magnesium. So if these are prescribed together, they need to be taken at 2-hour separate doses. Calcium channel blockers, they should not be, well, there could be a possible beneficial interaction, but they need to be used under supervision. They're the main ones that I would think of for magnesium. So hopefully you've learned something from that today, and please feel free to ask any questions you have, and consult us naturopaths. Thanks. This time I'm going to talk about an anti-inflammatory that you guys can use. This one's a metagenic one, and it's called Inflavonoid Intensive Care. I'll tell you what's in it. It's got turmeric, and it's a blend that is a proprietary formula, so it's a more absorbable blend. It's got boswellia, another great anti-inflammatory herb, salix alba or willow bark, ginger, it's got quercetin, it's got citrus bioflavonoids, as well as cayenne. So all proven anti-inflammatory herbs, as well as synergistic nutrients to support the anti-inflammatory action. So this can be used, of course, for arthritis, but also for any acute injuries, any sporting injuries. So why is it effective? Why is it more effective than something that you get off the shelf? Because I get a lot of people who come to me and ask, oh, why can't I just add turmeric to my food? Why can't I just add heaps to my food? Okay, well, turmeric, yes, it is anti-inflammatory. It will help, but you need massive doses of it. And it's not actually very absorbable on its own, unfortunately. So at a maintenance, on a maintenance level, if someone didn't have the injury or the amount of inflammation that they have in something like osteoarthritis or rheumatoid, yes, sure, then they could have some turmeric to cook with, or to get something from the supermarket. But the turmeric that has been found to be more clinically effective is this one here, which is called BCM95. Yes, so it's one that's been found to be about 700% more effective, more absorbable than turmeric on its own. So it's enhanced bioavailability of curcumin, which is the active compound in the blood that has been found to be more effective than the ones off the shop. So another one in there is boswellia. Boswellia has the analgesic, anti-inflammatory, anti-arthritic effect. There's also a proprietary blend of boswellia in this one, so that it contains no less than 70% of organic acids. These are the active compounds that you want to have in a boswellia that you're taking. So it's really important because, again, off the shelf, you don't really know what you're getting. They're often not standardized extracts off the shelf, and you don't really know which plant part it's coming from or whether the plant species is the correct one that you're getting. Another thing is with contaminants. Some of the ones on the shop could be contaminated if they haven't been tested, especially if they're coming from overseas. You really don't know what's in it, and there are lots of herbicides in plant products, pesticides, heavy metals, you name it. There really can be a lot of problems with herbs coming from overseas. Another herb in here is Salix alba, or white willow bark. This has been used in herbal medicine as a natural analgesic and anti-inflammatory, anti-rheumatic and antipyretic. It's also traditionally used for musculoskeletal pain, arthritis and gout. Now the one in the Metagenics product, again, this is a standardized extract which has no less than 15% of the active compounds, which is the salicin. So unlike the non-steroidal anti-inflammatory medications that a person might be on, research has shown that willow bark does not have those gastrointestinal side effects, such as bleeding, that the normal NSAIDs would cause. And that's really important to know as well. And this is because the willow bark that's used, it contains a whole lot of chemical compounds in there, natural ones, that work synergistically, as opposed to, say, aspirin on its own, which is a chemical compound containing the salicylates, but it doesn't have the balancing compounds to protect the mucosa in the stomach lining. So that's an important difference with using a whole herb extract of something like white willow, Salix alba. Another herb in here, as I mentioned before, is ginger, great anti-inflammatory for arthritis. And quercetin is in there. This is a bioflavonoid. It is found in things like onions, it's found in garlic, it's found in apples, broccoli, but of course you're going to get not such high doses just from the diet alone. It's also an antioxidant, so it's also been found to work well synergistically with those anti-inflammatory herbs that I've mentioned. So some of the contraindications. So anyone who has a salicylate hypersensitivity as well, salicylate, it's really important that you ask them, because some people have that allergy or intolerance. Now, some of the cautions are, for example, with surgery, these are not recommended 1 to 2 weeks before surgery because they can have a blood thinning effect. Chemotherapy, you also need to be aware, even though curcumin, turmeric, is like a huge herb that's used often in cancer treatment alongside chemotherapy, it is not recommended to use alongside all chemotherapies. There are some chemotherapies that curcumin is not recommended to be used with, so please be aware of that. We will print out the text sheets as well. Gallstones, ginger is contraindicated in gallstones as well as turmeric because it can increase contractions of the gallbladder. Another one is any sort of kidney dysfunction. Theoretically, the salicin or the willow bark, that can reduce kidney blood flow. So if you use it for a long time at high doses, it can contribute to renal failure in people who are susceptible already. So it's really important to monitor people who are on something like this, which is why it's practitioner only. If there's more sort of chronic pain going on, then we can use something else as well. But please come and talk to us for that, because we have other formulations available. Anyone with peptic ulcers or gastrointestinal inflammation, they should also use ginger or willow bark with caution because it can be irritating. And also cyclosporin. People who take quercetin with cyclosporin, there can be a nutrient medical interaction there. So please be aware of that as well, and avoid the same concurrent use of quercetin, which is in this, and cyclosporin. Okay, so hopefully that's been helpful, and please come and chat with us if you've got any questions. Thanks. This time I'm going to talk about fish oil. So there's so much I could say about fish oil off the shelf. There's a lot of fish oil that you can get from supermarkets that people are on, and there are a lot of problems with contamination, such as with mercury. You don't know where the fish oil is coming from. A lot of it's coming from overseas. You don't know what type of fish they're using to extract the fish oil from, and a lot of the times the dosages are not high enough either. And there's also a lot of talk about krill oil versus fish oil. There's so much information going on that a lot of it seems really confusing. So it's really important with fish oil that you've got a very pure form of fish oil, and it's potent, so it's actually going to work for your client. And another thing, that it's fresh. And you can actually tell if you get your client to open up the capsule that they're using at the moment, bite it, or open up with a little, poke it with some scissors, and just taste it and see what it tastes like. And oftentimes it just has such a bad odor from the fish that they've used, or it's been on the shelf for too long, or on the shipping containers for too long, that the smell of the fish oil is enough to show them what they're really using. So we recommend at Atune this one here, the bioactive lipids from Orthoplex. This is a white label one, so it's a practitioner only one. It's got a really high dose of the EPA and DHA, which are the active ingredients, and this actually has been independently third-party tested. So it's purified in Norway, and it's tested before as well as after encapsulation to test for the presence of contaminants, to also check for freshness, to check for the active ingredients, that they are still there at that high dose, and to check for the purity and the potency. So you can really be confident that you're going to prescribe something that is effective, something that is not going to cause an increased toxic load on your client, because how many walk in our door who are overladen with toxins already? And you can be confident that you're going to prescribe something that is effective at the dosages that you use. So again, with these ones, it's a soft capsule, so even kids can have this. My kids have them. So you can just chew on the capsule, and it has the only ingredients that are in there are the purified fish oil, and the fish is from Norway. It's like the wild caught sardines or anchovies. That's all they use. And then they use non-GMO caprylic acid, that's a bit of coconut oil, and they use non-GMO natural orange oil. That's it. There's nothing else in there. So they declare all their excipients that they use. So another thing to just be aware of is with the cautions with any sort of anticoagulant medication that your client may be on, whether they're on warfarin or aspirin, just be aware it's not contraindicated, but you need to be aware of the dosage that they're having. So if they had something like 2 capsules 3 times a day, that would be a total of 600 milligrams. There's 600 milligrams of DHA, EPA in each capsule. So often we would prescribe 6 capsules a day. It's for someone who's has a lot of arthritic pain, for example, or someone with fibromyalgia, and that's still not going to be 6 grams or 12 grams of fish oil, which is contraindicated together with warfarin. So just be aware of the dosages that you're prescribing as well. Anyone with a bleeding disorder, and also before surgery, that would also be contraindicated. So 7 days before surgery, I wouldn't use any fish oil. So thanks very much. I hope that's been helpful. Okay, so now I'm just going to go through quickly some of the differences between using something like the Arthrex fish oil and in flavonoid intensive care, because I've talked about each one of them in detail in my other videos. So for example, if someone walks in the door with a sporting injury, more of acute flare-up of say gout or arthritis, then I would use something like this, because this is more for a quick relief. The dosages here is 1 tablet every 2 hours, so you can take up to 6 tablets a day. But when I've talked to tech support, I've also heard that you can actually take 2 tablets every couple of hours. So we can increase the dose as long as you're aware of any medications that they're on, or any sort of other medical conditions that they might have. So this is more of a quick acute injury sort of formula here. They could also use fish oil concurrently with this one. So because fish oil is a general anti-inflammatory, it helps to reduce the circulating levels of some of those inflammatory cytokines. So someone with, say, a chronic inflammatory state could really benefit from the fish oil. So yes, something like fibromyalgia, for example, arthritis, yes, as well. At the same time, we have to also talk about diet, because if people are taking these and yet still eating their Maccas or their fish and chips, a few times a week, they're just throwing money out the window. It's really no point. So please be aware that we shouldn't be prescribing these without talking about diet as well. So we need to, for example, with fish oil, be avoiding trans fatty acids. This is in margarine, this is in cheap takeaway foods. That's actually going to block the action of omega-3 fatty acids. So why put food in your mouth that's going to block this? It's just a waste of money. So with the Arthrex, again, this is more of a joint formula. This has got the glucosamine in it, it's got the gelatin, it's got the MSM. So for anyone with cartilage degeneration, osteoarthritis, also for rheumatoid, you can use this one. So this is more specific for the joints and cartilage, for that repair, any sort of joint pain. Gelatin will be fabulous for that, as well as the glucosamine and the vitamin D, the vitamin K. That's all really specific for joint health, for bone and for cartilage. Okay, well, I hope that's helped to sort of clarify some of the confusion there. Thank you.